LND labor and delivery. LAM lactational amenorrhea method. LAVH laparoscopic assisted vaginal hysterectomy. LEEP loop electrosurgical excision procedure. LGA large for gestational age. LUXIL low-grade squamous intraepithelial lesion. LMP last menstrual period. LOA left occiput anterior. LOD laparoscopic ovarian drilling. LOF leakage of fluid. LOT left occiput transverse. LTCS low transverse caesarean section. LTL laparoscopic tubal ligation. LUNA laparoscopic uterine nerve ablation. MA mono amniotic. MCH mean corpuscular hemoglobin. MCV mean cell volume. MESA microsurgical epididymal sperm aspiration. MFPR multifetal pregnancy reduction. MHT menopause hormone therapy. MI myocardial infarction. MIG metformin with insulin in gestational diabetes. MVA manual vacuum aspiration. MVP maximum vertical pool/pocket. NST non-stress test. NSVD normal spontaneous vaginal delivery. OA occiput anterior. OAB overactive bladder. OI ovulation induction. OP occiput posterior. P parity. PAPA pregnancy associated plasma protein A. PCB post-coital bleeding. PID pelvic inflammatory disease. PIH pregnancy induced hypertension. PLGF placental growth factor. PM postmortem. PMB postmenopausal bleeding. PMDD premenstrual dysphoric disorder. PMOF premature ovarian failure. PMR perinatal mortality rate. PMS premenstrual syndrome. PNV prenatal vitamins. POI primary ovarian insufficiency. PP postpartum. PPD postpartum day. PPH postpartum hemorrhage. PROM preterm premature rupture of membranes. PPS postpartum sterilization. PPV positive predictive value. PROM premature rupture of membranes. PSTT placental site trophoblastic tumor. PT prothrombin time. PTL preterm labor. PTT partial thromboplastin time. PUBS percutaneous umbilical blood sampling. PUL pregnancy of unknown location. Q quickening. QD each day. QID 4 times a day. RA rheumatoid arthritis. RBC red blood cell. RBOW rupture of bag of water. REDF reversed end diastolic flow. REM rapid eye movement. RF retroflexed. RFM reduced fetal movement. ROA right occiput anterior. ROM rupture of membranes. ROP right occiput posterior. ROT right occiput transverse. SAB spontaneous abortion. SB stillborn. SDE suction, dilation, and evacuation. SDP single deepest pool/pocket. SGA small, for gestational age. SHBG sex hormone binding globulin, SIDS sudden infant death syndrome. SIS saline infusion sonogram. SOL spontaneous onset of labor. SROM spontaneous rupture of membranes. SSR surgical sperm retrieval. STD sexually transmitted disease. STI sexually transmitted infection. SUI stress urinary incontinence. SVD spontaneous vaginal delivery. SVE sterile vaginal exam. T3 triiodothyronine. T4 thyroxine. TA transabdominal. TAH total abdominal hysterectomy. TAH/BSO total abdominal hysterectomy and bilateral salpingo-oophorectomy. TAH therapeutic abortion. TB tuberculosis. TBA thermal balloon ablation. TBG thyroid binding globulin. FT's thyroid function. TLH total laparoscopic hysterectomy. TOLAC trial of labor after cesarean. Top termination of pregnancy. TPAL term, preterm, aborted, living. TRH thyrotrophin releasing hormone. TSE testicular sperm extraction. TSH thyroid stimulating hormone. TSI thyroid stimulating immunoglobulins. TSS toxic shock syndrome. TSST toxic shock syndrome toxin. TTN transient tachypnea of the newborn. TVH total vaginal hysterectomy. TVS transvaginal ultrasound scanning. TVT tension-free vaginal tape. UA umbilical artery. UAE uterine artery embolization. UIQ upper inner quadrant. UOQ upper outer quadrant. UPI uteroplacental insufficiency. UPP urethral pressure profilometry. US ultrasound. USI urodynamic stress incontinence. UT uterus. UTI urinary tract infection. UV umbilical vein. Vein vaginal intraepithelial neoplasia. Vein vaginal intraepithelial neoplasia. VBAC vaginal birth after cesarean section. VD volume of distribution. VFI viable female infant. VIN vulvar intraepithelial neoplasia. VMF viable male infant. VMS vasomotor symptoms. VT ventricular tachycardia. VT venous thromboembolism. VTX vertex.